My name is Peter Fairburn, and I'm the Clinical Director of Ethos and Regeneration Limited. What I'm going to do today is introduce you to something that I have been working on for over 20 years. And this is about how to optimize host healing and utilize this new generation of synthetic graft materials, Ethos. And this is a process which I have called True Bone Regeneration from 2008. So let's first of all just talk a little bit about myself. I have been placing dental implants since 1991, and it's finally led to me forming a product which I'm happy with, and that I get the results that I'd always dreamed that I could actually get more simply and with less trauma to the patients. And in medicine, no one uses xenografts, which are animal donor products. And what we're seeing in this new research, the patients themselves are becoming more aware. Our world is becoming more vegan. We're more concerned. And having animal products put in them for the rest of their life is something that simply does not appeal to them. But this is not just about what patients want. This is also about what the body wants. The body wants to heal. It wants minimal surgery. It wants to do the work. The body is the miracle, not me. I'm not no miracle. I'm just a mere mortal dentist doing 5% of the work. The body is doing 95% of the work in regeneration. This is why the less surgery we do, the better the outcome. And this is something now that is widely known in medicine. Unfortunately, this massive use now of synthetics in medicine has not really got to dentistry. We seem to lag way behind our medical colleagues. And this is what we're trying to do, is catch up and understand the incredible benefits of using these materials. That's how I started Ethos in 2013, by actually wanting more. And it's led to a massive growth in the company. And the most important thing is returning the patient back to the state they were before. And this is the key to true bone regeneration. But primarily, the body is much happier. What we don't understand as dentists a lot of the time, and the doctors are very, very aware of, and that is that bone is living tissue. The bone needs to turn over constantly to be healthy and to survive long term. The moment we place foreign material, this ability to turn over is impeded. My regeneration centers are my patients. I understand that I cannot regenerate any bone in any patient. All I can do is do as much as I can to encourage the host to do the healing themselves. This is the critical thing. We have to understand how the body is working, how it is healing, and how we are merely optimizing this miracle. Say a patient loses half their liver, the doctor will know that the body is a miracle, will replace that half that's been taken out in 21 days. But as dentists, we're taught to use our hands. So we would think, well, I'm sure I could do a better job than the body. No, the body has been healing bone using the periosteum for thousands of years, in millions of cases. And the clever thing about Ethos is the way that we can actually replace the need for the use of a membrane by making a stable graft. By having beta TCP, which forms 65% of the volume of Ethos, combining it with 35% per volume of calcium sulfate. This calcium sulfate has a multifactorial function. It actually stabilizes the graft, enables it to set to a reasonable level and set hard so we can suture over it, and it holds its volume. It's also bacteriostatic, so it prevents the growth of bacteria. It helps to let the soft tissue heal enormously. And the other factor, obviously, it's biocompatible. Now, this is what the body likes. The body likes biocompatible materials because it allows the body to heal and the soft tissue to heal, so we get great soft tissue healing. And the other factor of biocompatibility is we don't get host giant cell foreign body responses. So in other words, we don't get as much swelling. And 95% of my patients do not need a painkiller the next day. And that includes big sinus augmentation and bigger grafts. It's simply the biocompatibility reduces the pain for the patient. Now, what's there not to like for the patient? Reduced pain, reduced surgery, no foreign animal or human product in them, turning over to all their own bone in the right time that the formation of bone is required, the material resorbs, because it's important for us to understand really what's happening rather than what industry is wanting us to work in a direction. Because we do need to change our surgical procedures a little to be able to optimize these outcomes. So I'd like you to join me if you register with us, and we'll look at the more clinical, as I say, easier cases, more complex cases. It will be an exciting journey, and maybe we can all improve our dentistry and grow stronger together and help the patients grow stronger. Thank you.